And are you doing this part-time, full-time?
My program it's a hybrid program, so it's virtual, but there are a lot of the classes have online option. With my job being in the West Coast, sometimes I can kind of flex and have morning classes or online classes. So it's a little bit of both. Yeah, and I'm in an advanced standing program because of the work experience that I have. So it's a little bit of the courses are somewhat condensed and we take less credits as advanced standing students.
And as you're someone that is working while doing your MPH right now, what value do you say that brings to your experience in your MPH program? Or vice versa, either way, the MPH program or to the
Yeah,
work you do.
yeah. That's something I think about a lot because for me, pursuing a master's in public health, I wanted a program that gave me a combination of both like practical and applied knowledge, like practical and technical knowledge, having the academic background, but also being able to apply it in a real world experience. And I believe that's one advantage of, I have over like 8 years of experience, nearly 10 years of experience now in public health. And coming back as a graduate student, I see that it's very beneficial in classes that require like discussions around management and public health entities. I have more familiarity with what healthcare systems, what some of the challenges are in healthcare systems, what some of the challenges are in governmental organizations than someone who maybe doesn't necessarily have that experience. So to me, it's been a wonderful combination of, bringing together my academic interests and my practical, like technical skills.
Absolutely. So would you say you're an advocate for working and doing MPH program?
Not necessarily. It depends. I
Okay.
think there's some programs that require a lot more like hands-on. My program, I'm just lucky enough where they offer a hybrid option, but there are some programs where it's completely in person. They don't really have an online option. So for individuals like that, I think that's a sacrifice or discussion that they would have to have to make that decision. But I do believe there is some benefit to having work experience before you pursue your master's, or even during your master's, maybe during the summers, or if you can do an internship while you're pursuing your master's, because a lot of programs they do offer internship opportunities while you're completing your program, and that's sometimes even a requirement. So I think it's personal preference, but also what your capacity is as your program decision as well plays a factor.
And I don't particularly like the word like work-life balance or the phrase work-life balance, but how do you have tools, techniques, ways that you are able to balance work life and all the things?
Yeah. Let's see. I I don't like the phrase work-life balance either because it's somewhat separating the two. I think it's hard to separate the two. In our field, public health is very heavy, and sometimes it's hard to step away from what you do day to day because you see it showing up in the world you live in. So you walk outside, you can identify like disparities that exist in the populations that you see. So it's like having a true work-life balance. Like the work doesn't stop at the door when we clock out at 5 p.m. or before we clock in at 8 a.m. So for me, I think it's important to have hobbies. I think that's one thing that I would encourage everyone to do is cultivate your hobbies. It's really important to have things that you like that are not related to necessarily your work or even school, things that you really enjoy, and making sure you're spending time. And if you're doing those things, that you're growing and developing areas in your brain that are like that bring you joy and comfort. So I like reading. You see some books behind me, but I also like exercising. I really love working out. I really love, hanging out with my friends, exploring new coffee shops. I love going to plays. All of those things kind of contribute to helping me balance my job and then also my personal life.
Yeah, absolutely. And I think we don't talk about enough the challenge that it is, even being like an not only like a public health professional, but an MPH student, but and just being a part and learning about health disparities and that's just being a part of what you're talking about day in and day out. And like to your point, then from learning that, then you're living in the real world and you kind of see those same things. And we don't talk about how that impacts I don't know, public health professionals. Maybe someone should do broader studies on that. But I think that it's important. And then, like, to your point, like, understanding how do we manage all of these things and live a life where we have hobbies and we have interests and may have no relation to public health or the work that you're doing, because these are things that are also just important for us to live healthy whole lives.
Yeah, I think it's turning the work we do internally, because our definition of health kind of shapes even how we conduct our life. Because for me, health is about like so many more things. How do I define public health? Physical, social, emotional, financial well-being, and then making sure that I'm taking care of myself in those areas of my life so that I can have optimal health as I've defined it. And then you can bring that outward. Like, it's easier to be able to educate communities when you have a solid understanding for what you define as like a healthy life.
Right. And I think, like, to that point, there's no one healthy life. It is really determinant on you and what you see as important for your self actualization, health actualization.
Yeah, sure.